Hey, it's Friday. It's TGIF Doc Talk with Dr. Go.
Hello, everyone, and welcome to Doc Talk, where we talk about health, aging, and everything in between. Today, we'll be diving into a very current and timely and important topic, which is about influenza in the elderly. Now, when we think about influenza, or some people will call it the flu, we imagine a few days of like fever, cough, and rest at home. And this is quite usual for somebody who is younger. But when it comes to the elderly, especially those who are of the age above 65, a simple flu can be very, very far more severe than a simple inconvenience or feeling just a bit of mild sickness. It actually can lead to a lot of severe complications and even hospitalizations, and can even be life threatening. And this is particularly true for the senior citizens who are bedridden and have other multiple chronic illnesses. Now, why are the elderly more vulnerable to the flu? Now, as we grow older, our immune system it gets weaker and weaker, and the body's ability to fight off infections like influenza is not as strong. Many elderly individuals have chronic conditions like heart diseases, like diabetes, or existing lung issues, whether it's asthma, whether it's bronchitis. These are the things that can actually make the flu symptoms more dangerous. And on top of that, for senior citizens, flu doesn't just cause fever and cough. It actually causes the lung to develop what we call bacterial superinfection, meaning to say, on top of the viral infection, flu is a virus. On top of the virus, you worsen into a bacterial infection. It's called bacterial pneumonia. And due to the existing illnesses, maybe they have diabetes or other chronic illnesses, it may cause a lot of dehydration. They might deteriorate very rapidly. It might cause confusion in the seniors. Now, most of the flu-related hospitalizations and death often occurs to those above the age of 65. And what we are seeing this year, particularly, especially now is the flu season, influenza A is running rampant in society. Many senior citizens actually, their flu actually develops further into pneumonia, and they will be hospitalized, and this may cause a lot of ripple effects towards extended family members, where they might need to get time off work, or they might need to find caregivers to attend to their loved ones, and it also puts a lot of strain on the healthcare system. Now, coming to the important part, so what can we do, or how can we prepare ourselves to face the flu season as an elderly person? Now, first and foremost, this is something that I very much recommend, is of course your annual flu vaccination. When you're vaccinated by the flu vaccine, it's actually the most effective way to reduce the risk. Now, it doesn't mean that once you're vaccinated, you will definitely not develop the flu, but the flu that you develop will have a very much shorter duration, and the symptoms are very much more milder. So, to all senior citizens, please do get your annual flu vaccination and make sure that it's the vaccine of that particular year, because the strains change with every year passing. Now, if you did in fact develop flu, there are certain medications in the market. When taken in the first 2 days or 3 days, it helps to prevent severe complications. Now, this medicine is called Tamiflu. It comes in various generic brand names, whether it's Flu Health or different kinds of names. And when you take this medication, you actually help to reduce the virus from replicating in your body, and it really shortens the duration of the flu. Now, for senior citizens who are, say, maybe above the age of 90 or 80 plus, and if especially those who maybe they have Parkinson's disease, or maybe they suffered a stroke before, where their body is already quite weak, and they might find it very challenging to expectorate, meaning to say remove the phlegm when they actually accumulates in their airways. One of the important things that they should do is to have regular chest physiotherapy, so percussions over the chest wall to help loosen up the mucus collection in the airways. And they may also take some medications to help expectorate the sputum, because this will help clear up and reduce the risk of developing bacterial superinfection, meaning to say from a flu and they become a lung infection, which is called pneumonia. So those are one of the key things, and of course, to regularly practice good hygiene habits, regular hand washing, wearing masks when you're sick, and also disinfecting frequently touched surfaces. This will actually go a long way in preventing an elderly person from contracting the flu. And of course, last but not least, keeping your overall health in check, regular medical checkups, good nutrition, and staying active all the time as much as you can to strengthen the body's resilience. So, the key takeaway message from today's podcast is that for the elderly, flu isn't just a flu. It can potentially be a serious health risk that we can do something about. And with timely vaccination, with good hygiene and supportive care, we can actually prevent ourselves from getting the worst effects of the flu. And that's it for today's podcast. And thank you for tuning in. And if you found this useful, don't forget to share it with someone who cares for an elderly loved one. Stay healthy, stay safe, and I'll catch you in the next episode. Bye bye.
Click the share button to share this episode to a friend or a caregiver and hit follow to keep up with our latest episodes. Thank you.